Have you been struggling to find that perfect outfit that says fashion? Well, look no further because Derm Mnemonics brings you the Chediak and Higashi Fashion Show, where every outfit is a statement and pigment is optional. This sketch is our second in the family of genodermatoses called silver hair syndromes. This is a group of autosomal recessive disorders characterized by pigmentary dilution with variable immunologic and neurologic features. The most notable disorders are Griscelli syndrome, Chediak Higashi, Waardenburg syndromes, and piebaldism. I want to preface this sketch by emphasizing that if you can remember which cells express the gene product under normal circumstances, you'll be able to predict what the manifestations will be. For CHS, it's the melanocytes, platelets, and granulocytes. So as a subtle reminder, we've added a C and H logo to the stage with the motto, Make People Glare, MPG for melanocytes, platelets, and granulocytes. Let's get started by introducing the main character in the sketch, who's going to be the face of Chediak Higashi. Notice her dress is made to exemplify this year's hottest trend, cheetah print. The cheetah print should remind you of Chediak Higashi. In case that doesn't do it for you, we've also included their logo on the curtains in the background and the C and H logo on the runway. Chediak Higashi syndrome, or CHS for short, is due to autosomal recessive mutations in the LYST gene. As a reminder, we'll include an advertisement for Listerine on the front of the stage. Note that LYST is short for lysosomal trafficking regulator gene, and when deficient, it results in abnormal trafficking of the melanosomes, platelet-dense granules, and lysosomes within the granulocytes. In a way, it's like this dolly on the stage, with its trafficking being impaired. Let's expand on this because it can be confusing. Griscelli syndrome is due to defective transport, which means movement or transfer of the vesicles. CHS is due to defective trafficking, which is slightly different and includes actions such as fission and fusion of the vesicles. Clinically, this manifests in numerous cutaneous and systemic symptoms. And you may have noticed this big smiling mouth on the Listerine advertisement with the slogan, Gingivitis, stomatitis, and ulcers? Not with Listerine! This mouth and slogan will serve to remind you that patients with CHS are very susceptible to severe gingivitis, periodontitis, and mucosal ulcerations, features that are commonly given as a clue to the diagnosis because they're not common in other silver hair syndromes. The other cutaneous findings you might see are shown by our model. As stated earlier, a key feature is silver hair, so let's give her some elegant, stylish silver hair. You should know that unlike Griscelli syndrome, if you were to examine the hair from a patient with Chediak Higashi syndrome under trichoscopy, you'd find small but regularly spaced melanosomes, just like these small but regularly spaced runway lights. Other cutaneous features include ocular pigment dilution and guttate hypopigmented or diluted macules on the skin. We'll show these by adding a pop of color with these bright red sunglasses, which are a recurring hook for ocular findings, and the guttate cheetah spot macules are to remind you of the skin macules. Interestingly, the acral and sun-exposed skin may actually have hyperpigmentation. We've shown this by giving her black hyperpigmented gloves to remind you of acral hyperpigmentation. Ocular plus cutaneous pigment dilution means Chediak Higashi is also considered to be a form of oculocutaneous albinism. If you've seen our sketch covering Hermansky-Pudlik Academy, you may recall that we use binoculars as a symbol for oculocutaneous albinism, and we'll bring that hook back with the addition of our first observer holding some fancy oculocutaneous albinism binoculars. They're not technically binoculars, they're opera glasses. But what's really the difference? A pretentious handle? She's no peasant, she's a fashionista. Look at her cheetah print outfit and red gloves. Now use your imagination and blur your eyes just a little bit. Doesn't her top look like a pair of lungs? Recall that if neutrophils are defective, patients are at high risk for pyogenic infections. In Chediak Higashi, this is primarily the lungs and the skin. The lung-shaped top is to remind you of recurrent lung infections, while the red gloves should remind you of the skin infections. Remember that the main pyogenic infections you should know are strep pneumo, strep pyogenes, and staph aureus. Now shift your focus to the back wall. You'll notice a bundle of blue wires kind of resembling a neuron. This neuron-shaped bundle of wires is to remind you that they develop progressive neurologic symptoms such as peripheral neuropathy, abnormal gait, and developmental delay. There's good news and bad news here. The good news is most patients won't have severe neurologic symptoms, but that's only because most of them will die by the age of 10. This brings us to Epstein's bar, where there's pretty much only bad news. It's thought that when patients with CHS are infected with EBV, they're at risk of developing a lymphoproliferative syndrome, causing an accelerated phase. Dun dun dun. Sadly, this accelerated phase occurs in 85% of patients, resulting in hemophagocytic syndrome with diffuse lymphohistiocytic infiltration of internal organs and uncontrolled macrophage and lymphocyte activation. The end result is death due to severe hemorrhage and infection, usually by the age of 10. While all of that is probably a little too much to include in detail, we'll include this father and son to help you remember the most important things. Try to remember that this jelly donut, being eaten and dripping bloody goo, is a recurring symbol for hemophagocytic syndrome. We'll add our recurring wash your hands sign to remind you of immunodeficiency and infections, and the spilled red drink at this guy's feet is to remind you of the bleeding diathesis and severe hemorrhage that they're prone to. Lastly, notice his son sitting next to him. The skull and crossbones on the boy's shirt is to remind you that they die young, and this boy looks probably about 10 years old. So let's run through the sketch and review the important features of CHS. Chediak Higashi is shown by the cheetah print and the model, the names on the curtain, and the logo on the runway. Their motto, "Make People Glare," should remind you that it's melanocytes, platelets, and granulocytes that are primarily affected. In the back left, there's this Listerine advertisement and Rec Dolly. These are to remind you that it's the lysosomal transport regulator protein, or LYST, that's mutated in these patients. When defective, it results in inefficient vehicle trafficking. The smiling mouth should remind you of severe gingivitis and periodontitis. These are unique among the silver hair syndromes. Our model with silver hair, red glasses, cheetah print, and black gloves is to remind you of the pigmentary changes manifesting as silver hair, light eyes, hypopigmented guttate macules, and hyperpigmented acrocytes. Remember that the fashionista with her lung-shaped shirt and red gloves should remind you of the recurrent pyogenic infections of the lungs and skin, while the opera binoculars should remind you that this is considered a form of oculocutaneous albinism. If the patient lives long enough, they'll have progressive neurologic deterioration manifesting as peripheral neuropathy, both motor and sensory, with intellectual impairment, so recall the neuron-like cables along the wall. Epstein's bar with the lines on the counter is to remind you of the lymphoproliferative disorder and the accelerated phase, which are thought to result from EBV infection. This occurs in approximately 85% of patients, resulting in a hemophagocytic syndrome with severe hemorrhage and infection leading to death, usually by the age of 10 years old. These features are shown by the dad and the son observers, with the dad eating the bloody jelly donut type thing to represent hemophagocytic syndrome. Spilt red drink is supposed to remind you of bleeding diathesis, and on the back, the wash your hands sign should remind you that they're immunocompromised, having frequent infections. On a high note, I guess silver hair is in fashion right now. Catch you next time.